Quiet on the set.
Oh my God.
Hello, hello. Welcome back to Talking Teeth. This is episode
9.
No, we're not sure. It's okay. We don't care. But we're so happy to see you and so happy to be here. We're talking about the dental profession. As you know, we're talking about teeth, but now we're going to get into the dental profession. Why does somebody want to be a dentist? Why do they even choose the profession? Why not medicine? Why not something else? And I have some really special guests here with you, and we're going to talk about that and how the dental profession is going, where it's going, and what you can expect from your dentist to tell you as they get into the career of dentistry to help you become healthy with your oral health in your mouth, your smile, and overall body health. As we know, the mouth is the portal to everything in your body, and therefore it must be healthy and it must take care of yourself. So welcome everybody. Our guests here are Dr. Smolen, Dr. Allan Smolen. He is my partner here at New York Smile Institute. He's been practicing for a couple of years in dentistry, not that long, and really enjoys it. He thought he wanted to retire after a couple of years, but he said, no, I'm going to move to New York, and I'm going to come work with you, Dr. Dean. So I was so excited. Welcome, Dr. Smolen.
Thank you, Dr. Dean. I appreciate that introduction.
How many years you've been practicing?
So I just started my 48th year, so
That's
I'm
it?
somewhat
Dr.
new
Smolen.
at this.
You're just still practicing, though.
Still
He
practicing.
hasn't figured it out yet. He's still practicing.
No, there are too many new things that are available today in dentistry that keeps me very, very interested.
And he's very smart, by the way.
And
That's
he's
why
a
I
great
have him.
chef.
We also have the famous Becca Morris is here with us. Say hello, Becca.
Hi. Thank you
House
so much
of Concerto.
Yes.
House of Concerto. Look it up. She's amazing. Organizes your parties, organizes events. She's an amazing marketing genius. We love her. And we also have Reese. Say hi, Reese. He's saying hello. Reese, say hello. Move it down, camera down. Reese is saying hello. He's hanging out, chilling. Now, we have a special guest here up from Fort Lauderdale. 26 years ago, I had a very nice phone call from the doctor, and they said I'm going to have a baby girl. Well, 26 years later, Krystina is here with us, and she wants to become a dentist. About 7 years ago, she was doing some things with the orthodontist, and she'll tell you the story. And she said, I think I want to go into dentistry, and I was like shocked because I had plans to expand my office, move my office, sell my office, and then I said, oh, I can't do any of that because now she's coming in. So, Krystina, say hello.
Hi, everybody.
That's
so
your
nice.
camera there.
Okay, I don't know.
Go ahead.
Hi, everybody. I'm Krystina. Nice to be here today. I'm excited to talk about dental school and my life, how it's been crazy so far. So I'm excited.
So the first question everybody's going to have is, why would you want to become a dentist and
I
put
don't
your
know.
hands in people's teeth?
I know. That's like the number one question all my friends used to say, like, how can you look in someone's mouth every day? I don't know. When I was younger, this is like now my story. When I was younger, I was a dancer. I've been a dancer my whole life. And
Amazing dancer, by the way.
Yes, I miss it so much. But I started off dancing, and I went to multiple competitions, studios, everything. And when all my teeth started coming in, they started coming in crooked. And I ended up having buck teeth, the whole 9 yards, narrow palate, all my mandibular incisors crowded. There was so much crowding, I literally thought I looked like Bugs Bunny. And I never wanted to smile at all when I was dancing, and that was like so self-conscious about myself. And
that was about 14, 13?
no, it was 12. I think
Oh.
I was started dancing when I was like 2 years old. So this
And we
was
have the before and after, by the way,
Yeah.
of Krystina. So we'll definitely show you
yes,
that.
for sure. And obviously, being my father's a dentist, and I'm like, why? Like, how are my teeth this bad if my father's a dentist? Like, what? Like, what's going on?
And then,
And
she
then
didn't
obviously
know, but I had the
tooth-
same problem. So
Obviously,
it's
like I loved when the tooth fairy came. Like, duh. He had her phone number. Like, he would call her every night and be like,
So
"You
that was a
lose
great
a
story.
tooth. You lose a
cool.
tooth."
Wait, let me
And
tell
I
that
would-
story. So I had a phone number of the tooth fairy. So
Of
when my
the
kids
tooth
were small,
fairy.
I said, look, I'm going to call her. And,
And
she's
I
gonna
was
come
like,
and take. And back then
I
it was
wanted
$5,
20
and
and I
now
wanted-
it's like $20.
Yeah.
And they're saying, oh my God. And I had Santa Claus's
Every-
phone. I had the tooth fairy's phone. I had the Superman's phone.
Like,
And I had Beyonce's phone. Very important to have that.
But yeah, he would call the tooth fairy, and I would be
It's so
so
funny.
I would be so excited that my teeth are falling out. But it ends up when I got to 12 years old, I was like, I can't be smiling like this. So I actually went to an orthodontist, Dr. Salzer. She works in New York
Dr.
City.
Jen Salzer was
University.
my student. She was the top of the class, A+ student, and she said she's going to go into ortho. So she's been doing great in Manhattan.
Yeah.
And that was the only person that I would send my daughter to, and she did a great job.
I basically got a palate expander when I was 12. I had that for about 6 months. There was such a weird appliance in my mouth at
A palate
12 years
expander is
old.
when your arch is very, very thin. They put metal bars in your teeth with the braces, and every day you have to turn with a screw driver
every
day.
morning-
I thought that was
Mhm.
just another name for a retainer.
No,
No,
it's
it's
a
literally
it's a
on your
machine
palate.
in your
Yeah.
palate, and you're screwing
There's a
it.
little
every
hole that he would
day.
put a screw in, and
And every day
Right,
it would expand.
You do it yourself, or you
Yeah.
have to go back to the
No,
guy?
no, by
They do
yourself.
it
There's a
yourself.
driver.
and you
screw
literally
it in.
screw it.
That
Every-
is wild.
And it
Yeah.
opens up your arch, and
Yeah.
it gives you a beautiful white smile.
So
So
once-
palate expanders are real, by the way. Go to your orthodontist. You can get one if you have a narrow palate.
Yeah, and then eventually when that had happened, I got braces. So
So
traumatized.
back to the
Yeah.
question: why did you want to become a dentist?
Well, after that whole experience, that took about like 3 years, and then I mean, look at my. I have to say, these are my
Pretty good
teeth.
job. Wait, aren't those veneers? Okay, those are
They're
real
not.
teeth. They
Those
look
are
like
my
veneers.
real teeth.
So Dr. Salzer
She
was your
really-
influencer.
Yeah, and obviously Dr. Dean as well. But I definitely felt like having a woman do my teeth and seeing somebody like she related to me so much. And even though she was older, she felt like I really thought I was being taken care of. And that's what I wanted to do to my own patients eventually. And then I ended up applying to dental school. And I'm 26 and now I'm a 4th-year student, about to graduate in 1 year. And I literally can't believe it.
That's
So
awesome.
I'm excited.
Excellent.
So
Yeah.
when she asked me what to do, I said, I think you should go make a name for yourself. And we figured that Florida was a good place to start for her at NSU Nova. And I enjoy coming down once a month. And it's just a nice weather. How's school in dental school?
School-
Like, how is that?
Getting in was definitely the hard. I would say trying to get into dental school, I think, is the hardest part.
So for
personally.
dental school, you have to go
Personally.
4 years of college. Then you have to apply to the dental school, but you have to take an application test. It's called the DAT, the dental admission test. Like the medical doctors have it, the lawyers have it.
Yeah.
And I think that's really the cutting point where they kind of say, if you don't make that, you're not
Yeah.
going to get in. And that's what gets people in or out, and that's it's one of the hardest tests to take.
Yeah. And then I personally, I thought that was the hardest part, trying to get over that like big hump and finally getting my score and then applying. And then once I got to school, I felt like, honestly, everything kind of fell into place. Yes, transition was hard. I literally moved from New Jersey, miles and miles away from home.
Yeah, but you come out of
But-
school, you take a test, and you go to the beach.
Yeah.
That is
It's
nice.
No,
pretty good.
honestly, when you're sitting there in sim lab for 4 hours waxing up a tooth your first year, you're like, where am I right now? But then you walk outside and you're like, wow, I think I'm just gonna go sit by the pool really quick and get a quick tan.
Dr. Smolen, when you were in dental school, where did you go to dental school?
So I went to dental school at Temple University, both undergrad as well as dental
Okay.
school.
And how was dental school back then? Was it 3 years back then?
I had just started after they switched from 3 to 4 years.
Right.
And so, and following up with what you just said, so for us, we would get to school when it was dark, and we would leave school, it was dark, because we were there all day. And luckily, we had a fraternity house that was a block away, and we would go to the fraternity house to finish studying. We had a small lab there, so we could work
What was your
after
size
hours.
of your class?
So there was 150,
150.
5 women, and all the rest men.
So this is a big
Wait,
transition.
wow.
So back in the 70s, 80s, and I went to school in the 90s, we had about 75% men. And now what's going on with the transition?
My class, I have 130 people in my class. I would say 70% is women and 30% is men.
Yeah.
Yeah.
So the women dentists have really gotten, really taken advantage of the dental community. I think they're very compassionate. I find the women have more of a motherly, taking care of people and taking care of patients. You're seeing the same thing in medicine. a lot of women are going to medicine and dentistry.
Yes.
I think a lot of the males are going into finance. Like my son and my other friends' kids are going, the males are going into finance and the women are going into the medical profession.
Like Krystina said, her being young and seeing that adult figure as a woman being a dentist, maybe she didn't even think about it. And as more women are graduating as dentists, as doctors, younger girls will see them in the world and say, hey, I can do that. I want to do that. It's
Yes.
possible. It's around me.
Yeah, and it's really look, it's a great profession. We help a lot of people. I think there's so many vast areas in dentistry. It's not just this, fillings and cleanings. There's so many different things in dentistry today. And Dr. Smolen, tell us about how you've seen your profession, and I mean, you've seen it for 30, 40 years. How have you seen it grow? What's the changes have you seen?
So there's been a variety of changes. For the first 30 years, we were making the transition from silver restorations to more tooth-colored restorations, and moving from single tooth dentistry to quadrant dentistry to full arches, where aesthetics became much more prominent.
Yeah.
For, once again, the first 30 years, everything was either a filling or a crown.
Right.
So we were taking away a lot more tooth structure. At the 25 to 30 year block, adhesive dentistry became much more, not acceptable, but it became much more predictable. And over the last 25 years, adhesive dentistry has really revolutionized what we do.
Yeah, and the interesting thing is that, I look at, on a daily basis, if you look at any commercials, video commercials, television commercials, poster, anything you see on any kind of billboard is always about whitening, Invisalign, bleaching, toothpaste.
Everything's
Everything's
about
So in terms
whitening.
of the public knowledge of dentistry, it's really gotten a heightened level. So
Right.
the average person knows about becoming better teeth, having whiter teeth, having a better smile. They're more conscious of it. And I think that's also raised the patient's perspective of, I want nice, healthy, white teeth. Right? They come in with whitening, they want braces, they want Invisalign, they want to look better, they want to feel better. That was not a thing when I was in dental school. It was fixing the emergency. It was fixing the tooth,
exactly.
replacing the tooth.
Yes.
You know?
Yes, that was all. And over the last 25 years, the advent not only of adhesive dentistry, but ceramic restorations, which are much more durable. When we first started doing composite, meaning plastic tooth-colored fillings, we found that supposedly they were going to replace the silver fillings. However, we found that if you make that restoration too large, it really didn't last.
Right.
So switching to bonded ceramic restorations gave us a much better long-term result.
Well, I definitely see the cases that I did 20 years ago, and the teeth, if they leak and if they decay, the patient loses the tooth. Whereas today, with adhesive dentistry, if something breaks or chips or falls out, the tooth is still preserved. So I think that aesthetic dentistry and adhesive dentistry have preserved the teeth long term for the patients than just putting a crown on it and the tooth is gone when the crown goes bad.
And I'll even say when I went through FMR as your patient, I had it in my head that you were going to whittle my teeth down to little sticks because my mom did that when she had her veneers done, 20, 30 years ago. And it really wasn't. It was very minimal, the shaving down, and it just surprised me.
Yeah, every patient should understand that veneers are very, very different than crowns. A crown is a full coverage cutting of a tooth. You're cutting away 50% of the tooth when you're doing a crown. When we're doing veneers, we're hardly cutting 5% of the tooth, not even sometimes minimal, like no cutting of the tooth. So a big, big difference from the veneer preparation to the crown preparation. Patients have to know the difference. You're not whittling down their teeth. That's the biggest conversation I have with patients. They said, I don't want to get veneers because you're going to cry, you're going to grind my teeth down. It's not true. It's not true. So let's go back to Krystina, dental school, torture, craziness. Yes, you got the sun, but you're miserable. They got a million tests.
Yeah.
So where are you now in the process? Did you take your boards? You have to take a test to finish to get your
Yes.
license. Are you going to stay in Florida? Or are you going to come to New York?
I'm coming back to New York.
Okay.
I'm
But
excited.
you should definitely get your Florida license.
Yes, so
By
the
the way, I took my Florida license last year. I have my Florida license.
Yes.
I will see many of you down in Miami. I'm coming down to Miami or Boca Raton. I will be there. So look for me.
Yeah, so right now I'm a fourth-year student, and the way that it works is your first and second year, mostly like you're taking classes, you're learning all about dentistry, and then the third and fourth year, you're in clinic treating your own patients. When you start your fourth year, you take the integrated national board. It's 2 days. First day was 7 hours. Second day was 4 hours.
Wow.
I studied for 6 weeks. I passed.
Woo!
Excellent.
So very happy about that. But now I'm a fourth year, so there's no more classes. So all I'm doing is clinic, which is great. You get to get all my requirements out of the way. And then in October and in March, we take the national boards. We have to prep teeth to certain measurements. We have to make sure we know how to clean teeth, and then we need to make sure
Root canals,
and then how to do fillings.
and do fillings, crowns, and that stuff.
Yeah, so then one of
That's the end.
and that's the end, and then I have to just take the laws and regulations of Florida, and because I go to a Florida accredited school, when I apply to take my boards and when I pass my boards, I will be licensed in Florida. But then when I come back home to New York, I will need to do a general GPR in a hospital for a year in order to practice in New York City.
Right, either 1 year residency and then
1 year
and then you
residency.
can start working finally.
Well, finally,
Yes.
And
money.
then I will give you the keys, and I can go retire finally. All
I have a
right?
quick question.
Yeah.
So I know in the office here we have so much technology. We have the Facebook, the 3D scanning.
Yeah.
Are they teaching you those things in dental school?
Yes, they are. Yeah, they're integrated within our fixed prosthodontics, which is fixed.
Well, but also
crowns.
NSU is one of the few
Yeah.
places that has the digital technology. We
Yes.
brought over
We had
the
we have
digital-
Rayface there.
Yeah, we
and we
brought
have
over
our
the digital stuff.
Steric
there.
machines, and we have Prime Scan. That's what we mostly use in the clinic to scan most of our crowns and bridges, which is great. But we get taught that in our second and beginning of third year, how to use those programs, which is great. Hopefully some residencies continue to have digital.
Have you talked to other students in other schools and compared how your school, is different than their school? Or is it kind
Yes
of the
and no.
same?
I feel like it's kind of the same. I know a lot of NYU students. They mostly, you also need to know how to do everything manually. Dentistry, at the end of the day, you need to know how to do the basics. You need to know how to take an impression, a good impression. You need to know what a cavity looks like, what decay looks like, and not just, because sometimes technology can break down on you, and then your whole appointment,
100%.
you're looking at this patient, you're like, well, I got to start from scratch, and you got to know what to do after that. But I feel like for the most part, digital's definitely taken a new turn in dental schools. It's just quicker and it's faster. You get the results quicker. But I think
Also, you could analyze. See, everybody has to
Yes,
understand.
that's true.
Digital technology allows you to have a quality control instantaneously, so that you take that scan, you take the impression, you look at the impression, you think it looks okay, but when they pour it, it's not really accurate. Whereas the scanner, you can look at it and say, oh, that's not good, I can go make a change.
Yeah.
The instructor, the doctor can look at it and say, hey, let's change that, doesn't look perfect. So the quality control, I think, is better with digital technology.
for sure. And
But when the scanner doesn't work, you have to be able to.
you gotta
Yes.
You have to do analog.
Yes.
Yeah. But I
Yes.
feel like for the most part, the school, requirement wise, you need to know how to do analog, and you need a certain amount of crowns analog in order to graduate, and you need a certain amount
Oh,
of
that's good.
a certain
Oh,
amount of
interesting. Digital.
what we call CAD CAM, digital dentistry.
So another
to
great thing about NSU
graduate.
where Krystina's going is that we are the first, FMR is the first course to go down there
Yeah.
and do provisionals, restorations.
Yes.
First one in any dental school to go down there. So we have 180 students that we teach in one full day of provisional restorations. And I'm saying that for the purpose of that the school is very innovative, the school is very advanced, and it's allowing doctors from all over the country to come and teach them. So I really enjoy being there when we're there. And I go there once a month, and it's a really great
And
experience.
I love having him come once a month because I get homesick.
Yes,
I
it
do.
always helps. Dr. Smolen, where are you today? What are you interested in? You've been doing dentistry for a long time. What motivates you in the morning to get up? How's dentistry changed for your life in the last 4 or 5 years?
Great question, Dr. Dean. And actually, I think about that when I do wake up in the morning.
What am I doing?
So just a brief history. So my original practice and where I grew up was in Pennsylvania, and my main practice there was for about 40 years. And it was interesting, but it was it was mostly focused on restorative dentistry. I started off doing, as a general practitioner, doing everything, and then I increased my education in every facet of dentistry and said, you know what, I don't have enough time to be really good at all the other specialties. I'm going to focus on adult restorative dentistry, from the simple to the complex.
Yeah, and I think what you bring up a point, and I want everybody to know this. First of all, dentistry is extremely difficult to get into. Secondly, it's really extremely difficult to get through dental school. And then the last part, you finally get out, and then you have to choose of what you're going to be doing. Because like I said in the beginning, there's all kinds of facets of dentistry. The incredible part of dentistry that I find is that at any moment in time in your career, I feel, you can make a pivot and say, I'm going to start doing this kind of stuff. And then you're going to say, you know what, I'm good at that, but I really want to start doing this kind of stuff. And that's really good in terms of an artistic perspective and a growth perspective, because things do get boring in any field. You're going to get bored. You're going to get tired of doing the same thing. If you can innovate different things in your profession that give you more excitement, get you more learning, he is an ultimate professional because he keeps on learning. You don't have it and then you say, that's it, I'm done and I'm finished. So that's what I love about dentistry, is the multifaceted approach, and that you can get into a certain type of dentistry, whether it's Invisalign, whether it's implant dentistry, whether it's aesthetic dentistry, smile makeovers, occlusion, sleep apnea right now. There's a big component of health, the joint, the neck, the breathing, the sleep, the bite, everything connected together with sleep. So how did this all happen? And heart disease and all these other things. So there's so many facets of dentistry. I've been watching him for the last 15 years, going to different fields and do different things, and I'm so inspired by you, by being next to you and saying, I want to run away. I want to get out of here. And you keep inspiring me to be better and start something else. And so talk about that.
So I've been very fortunate that once I moved from Pennsylvania, and there's a story behind this, I came here to New York and I had met Dr. Dean, and I first started learning from him as a participant in the FMR program. And once I did that, it kind of opened my eyes to a much wider view. I was very fortunate subsequent to that you asked me first to become an instructor at the FMR program. Subsequent to that, to work here in the office. Number 3, one of my previous participants that I worked with, had me start working with him on the Upper West Side, and every year there has been something new and or different for our office on the Upper West Side, where I work 2 days a week. We have a small 2-chair office and doing all kinds of crazy dentistry that's been enormously successful for the practice. And next month, we're moving from a 2-chair office to a 7-chair brand new office.
That's
great.
awesome.
So there's, to me, every day, every week is something new. But the bottom line is that, as Dr. L.D. Pankey said many years ago, that he never saw a tooth walk into the office. So we're treating people, and people are what makes everything interesting.
Speaking of people, why did you decide to start working with Dr. Dean, and how has that been?
So,
Gonna love
Loaded question.
right. So,
Loaded question.
so this
Why or how?
How?
so
How and
so
why?
we'll start off with how.
How?
So, in my practice in Pennsylvania, I saw patients 4 days a week, and on Fridays I spent time with education, with paperwork. I still have a very difficult time delegating anything, so I did everything, and that Friday was my catch-up day. At the time, when my wife and I got married, she originally came from the Upper East Side, and she reluctantly moved to Pennsylvania, but said that when we get to a certain point in our lives, we're going to move back to New York. So I'm sitting on a Friday, and a brochure comes on my desk that says there's this program, full mouth rehabilitation, at NYU, and I said, okay, time for me to sign up to find out if I know anything, number one, and to make contacts so that eventually I can find a place to work.
Which was actually really brilliant, because the only way you can move from one city to another city is you have to meet people. And I think that with that decision that you made, not only did you meet people, not only did you get involved, but you just met a lot of people. And it really opened
Yes.
up your world to the possibilities of New York City.
Yes.
I think beyond your expectations.
Oh yes, 100%. I'm very adaptable, and throughout my career, I've worked in many other
Oh,
offices.
he didn't tell you he could leg press 450 pounds. Just saying.
Well,
can.
that's another side. That in dentistry, you must keep yourself both mentally and physically healthy. Otherwise, your career becomes very, very short. We could talk about exercise at another podcast, and I'd be
that's a
more
good
than
one.
happy to help people with that. But ultimately, once I met Dr. Dean, so let me take a step back.
Oh no, you're gonna talk. You're going too far back. We're talking about now.
But how I took what I had already learned. So I continued my education at some fairly high-end continuing education programs. I spent time with the Dawson Academy, at the Pankey Institute, at the Piper Education Center, and when I put all of those things together, it worked, but it was much more complicated. When I met Dr. Dean and I saw what he was showing, and it wasn't just here's how it works today, but here's how it has worked for the last 20 years, I was able to put that all together and see how it would be not simple, but it would be less complicated to be able to restore people's teeth to good health, function, and aesthetics. And to me, that's really what had made the difference. So it's been able for me to be able to see the issues and come up with solutions for some very difficult situations.
Now you guys have been talking about why and how you got into dentistry. I'd like to share why I did not.
Everybody's wondering why Becca's not going to dental school.
My oldest brother is actually a dentist, and I was very young, maybe 12 or 13, when he graduated dental school. And I'll never forget it. We threw a big party in our backyard, and I thought, you know what, maybe this is something I want to do. So I took my younger brother to the basement, flossed his teeth. He came out with a mouthful of blood, and I said, nope, never again. This is not what I'm going to do.
She's practicing in the basement.
Let's fix my brother's teeth.
It could have turned out like a big inspiration,
But no.
but it didn't. Feel like
I had too heavy hand, yeah.
blood was like, forget it.
Exactly.
Well, anyway, I want to say thank you to Dr. Smolen for many years of service to the patients. He's been, from my perspective, my partner in terms of the reliability that I can rely on him for things that I need, patients' needs. If I'm not here, I know the patients are taken care of. So having a partner like that is invaluable. My advice to the dentists out there who are 30, 35 years old is you have to find a partner. You cannot do this profession alone. Today, more than ever. Back in the earlier years, you could do by yourself, by two chairs. I found I cannot work alone. It's incredibly impossible. And I want to thank you publicly for all the help that you've done for FMR, for the patients, for the educational process at NSU. We go down there, we do hands-on. We've taught over 4,000, 5,000 in the last year, and Dr. Smolen has been a real the backbone to the FMR program. So thank you.
You're very welcome.
You very much. Krystina, it's so good to see you.
Yeah, it was really fun.
I'm glad that you're going to be graduating, and you're going to be going to that wonderful residency somewhere.
Somewhere. I don't know where.
And we look forward to introducing you to the practice and taking over, so I can relax a little bit. It's been too much.
It's time for you to relax.
Becca, thank you for being here.
Always a pleasure.
Always a pleasure.
Yes.
Thank you, guys. We'll see you again.
Good.
Next episode is on digital technology with Dr. Ari Kotsubis. Long story about him. We'll see you soon. Take care.
Right.